Hi, I'm Dr. Ivan Puah, and I founded Amaris B clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. I've been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for visceral liposuction, and Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift, and also under Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. What is lipedema? Lipedema is a chronic medical condition which characterized by symmetrical accumulation of fat cells in the upper arms, lower legs, and even in the lower body. Patients with lipedema often presented with symptoms of pain, swelling, bruises, discomfort on areas which is affected, such as buttocks, lower legs, and arms. What are the key characteristics of lipedema fat? It usually appears to be symmetrically distributed, such as both arms, both lower legs, both buttocks, so on and so forth. Patients usually complain of pain, tenderness, uneven texture, nodular feel, bruises, and swelling. It may even affect their posture and mobility as well. Who are the people that get affected by lipedema? Lipedema mainly affects women, and especially exacerbated by hormonal changes, such as in pregnancy, adolescence, menopause, so on and so forth. According to data research from US, up to 11% of females are affected by this condition. There are 3 stages of lipedema. For stage 1, which is mild, the skin appears smooth. However, if you palpate carefully, you can actually feel there's a nodular feel beneath the skin. Stage 2, moderate, the lipedema fat exhibit mattress-like pattern with visible nodular pattern can be seen underneath the skin. For stage 3, which is severe, besides nodular texture that can be seen, there are hypertrophy fat folds appearing around the region as well. Furthermore, you can classify lipedema into 5 types based on the anatomical distribution of the fat layers. For type 1, the fat accumulates in the buttocks, pelvic, and hips. Type 2, the fat accumulates from the buttock to the knees with fat folds around the knees. Type 3, the fat accumulates from the buttock pelvis all the way down to the ankles, sparing the feet. Type 4, fat accumulates from shoulder to the wrist, which is the upper body. Type 5, fat accumulates around the calves. Of course, there are combination types such as type 2, type 4, and type 3, type 4 affecting certain individuals. Lipedema is often poorly diagnosed. First of all, it's poorly understood. Many doctors, many patients do not understand the etiology, the pattern, and even the existence of lipedema. The presentation of lipedema can often be mistaken as obesity due to weight accumulation. The percentage of people presented with lipedema is relatively small compared to those affected with obesity. And that's why this condition is poorly picked up. The diagnosis of lipedema is purely based on clinical diagnosis from symptoms such as symmetrical fat accumulation around legs, buttocks, pain, bruisability, the textural appearance, so on and so forth, based on signs that's exhibited by the patients. There is no laboratory tests or any kind of radiological tests to confirm the diagnosis at this point. So based on symptoms, patients were often presented with symmetrical accumulations of fat around the legs, the arms, which doesn't go away with exercise or weight loss and get worse with age. Pain and discomfort, heaviness around the affected areas, bruisability, heaviness, so on and so forth. And the signs that are shown by the patients that can often be picked up by doctors during clear examinations is the appearance and the distribution of fat, cool skin temperature, tenderness, and of course, the textural appearance. And also to exclude fluid accumulation, or what we call edema, that could exist in these patients, such as fluid overload, lymphedema, and so on and so forth. These are things that we look for to exclude or to confirm lipedema in the patients. So what are the differential diagnoses, which means how do we differentiate lipedema from other conditions which is similar to it, such as obesity, swelling, or even cellulite? Lipedema is typically classified by pain, tenderness, and bruisability on the affected area. While obesity patients are usually overweight, and the fat accumulation is not limited to the limbs or the arms, but usually on other areas such as the central portion of the abdomen, the face, the trunk, and so on and so forth. While fluid accumulation such as lymphedema can often be differentiated by palpation or physical examination on the lower parts to exclude water retention by looking at any kind of like a pitting signs on the lower parts of the ankle, shins, calves, and so on. How do you manage lipedema? For someone who had lipedema, cannot be avoided. They usually get triggered off by hormonal changes at certain stages of life. Very often, you cannot slim down or make the fat go away on the affected area. However, for patients who are suffering from pain, discomfort, and heaviness, there are treatment, surgical and non-surgical, which can alleviate, manage, or even improve the symptoms. For example, non-surgical treatment such as compression garment, putting on affected area to reduce the swelling and pressure, and even help improve the pain and discomfort that the patient feel while doing the activities walking around. Lymphatic massages, lymphatic drainages, diet management, exercise, managing the activities, to help patients to be able to conduct the activities comfortably while handling the symptoms, or even help to improve the symptoms with all these things. If patients still feel that it's symptomatic and all these measures really doesn't help them a lot, then surgical treatment such as liposuction could be the solution for them. Although liposuction may not be able to cure them, but if it's done properly, it could help improve or even reduce the symptoms, allowing them to carry on their activities and life comfortably. There are many cases where I've treated patients who have been suffering with lipedema, having failed non-surgical conservative management with liposuction. If it's done properly, they do actually see the quality of life improve tremendously after that. Women with lipedema live with unbearable pain and invisible symptoms. We need to raise awareness of lipedema in Singapore so that women affected by this chronic condition can receive the necessary care. Thank you for listening. If you have any questions, just email us. See you again.